and this is our title for the day. And we really designed these hours. I'm not going to repeat about the Netflix, but this will be available. This whole hour is available after today, on Netflix and on podcast, on Facebook and everything. So you can, if you miss anything or your friends miss it, you will have access to it. But we really wanted something, instead of the midwifery festivals that have gone on for a long time and also a lot of people attend, we wanted something for midwives, for student midwives, for doulas, for people who wanted to become midwives, just to give you a snapshot of information once a week and bring people together. Because we were very aware that some people were in practice and obviously very busy with everything that COVID-19 is bringing to them. But we were also aware that some people are on lockdown, either because they're shielding or they're being shielded. And we wanted to make sure everybody retained that family, the family feel of being a midwife. So that's why these hours came into being. I also want to spend a moment, and I always do this, I just spend a moment to think about the people, especially in the health and social care areas, who we've lost over the last few weeks, because many people who are listening to this hour will know somebody, or their friend that might have had a friend or a family member who's been hit by the COVID-19. And I'd just like to say we are thinking about all these people, precious people, and their families, the people that we lost. It's very sad. You know, there's over 200 people who are lost, and we're with you on this. So this is just our moment of solidarity for all of the NHS and key workers and their families and their friends. So many people are being affected over these last few weeks. And the key workers, well, that's just about everybody who keeps the country going, from the lorry drivers to the bus drivers to everybody, the dustmen, everyone who keeps us all going and keeps us comfortable and safe. And we need to say thank you to all of them. I always also put this slide up just to remind us that this is still the year of the nurse, and it's still the year of the midwife. We started the year on a very positive note because we thought it was going to be a time of celebration, happiness and joy. I think what it has been is a time of celebration, in a way, of nurses and midwives, because they've really come up to the plate. They've been centre stage of the whole crisis and have illustrated how important they are to the NHS and to the population and to the whole society. So in a way, this is still a celebration, but although it's a very difficult, painful time. I'm just highlighting some news. This is another bit of my task. It's a tricky week because some people are returning to work, but now instead of staying home, we're meant to stay alert. But for some of us, that still means staying at home. We had International Day of the Nurse yesterday, 12th of May, so there were many celebrations and plaudits going on there as well. And I just thought I'd highlight the UK Obstetric Surveillance System, otherwise known as UCOS study, which has reported, I think a couple of days ago, on the basis of 429 pregnant and childbearing women, finding that at the moment, pregnant women are no more at risk than the general population. But like the general data that's being gathered for people who are affected by COVID, BAME women are more at risk at the rate of 55%. And women also who've got pre-existing health conditions, they're more at risk of being affected. And 5 pregnant women have died. Though it's uncertain at the moment whether this was due to COVID-19, they're still under investigation. And 1 in 10 women required intensive care, and it seems to be that women in the 3rd trimester are more affected than those in early pregnancy. So I mean, it's just a little snippet, and you can get more information looking at the MPEU website for that. There's still, I just wanted to highlight the Midwifery Forum online streaming for the International Day of the Midwife last week. We just had some fab speakers, including Roy Lilly, Jess Phillips talking about domestic violence, Professor Mary Renfrew and Professor Leslie Page, and the team from the Practicing Midwife, Anna Byram and Claire Feely, plus there are lots of top clips to look at. So they're still on the agenda for us. So again, maternity service, we carry on throughout. Antenatal and postnatal care still required and at a high level, and mothers and women, babies are still being born. And I think that because this is the centre of this evening's session, mothers and babies still need information. They still need care and support for themselves and their families. And we really felt that this was the time to look at some of the debate that's been going on about infant feeding. There's lots of stories in the press that I think women are getting worried about, and also midwives are getting worried about. So I'm really so pleased that we have two experts to come and share their expertise with us. So I'm going to firstly introduce Francesca Entwistle.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.